Do you suffer with pain? Are you looking for relief? There is help. Welcome to Back Talk with Dr. Steve Linninger, brought to you by Manassas Chiropractic and Rehab. And now, your host.
Thanks so much for joining me this week for Back Talk with Dr. Steve Linninger. I'm Kimberly Henrie, and today we are going to talk about lower back pain. Someone with low back pain can be caused by an accident, work accident, or any type of trauma, acute or severe. Now, before Dr. Linninger joins us, just a reminder that if you have questions at any time, please visit us at www.chiropractor-manassas.com. We know how injuries and pain can also develop over time, affecting happiness, well-being, quality of life. The most common solutions include surgery and strong doses of pharmaceutical painkillers. In our chat, Dr. Linninger will cover the solution to relieving low back pain without the use of pharmaceutical drugs or debilitating surgery. Dr. Linninger, it's great to be talking with you again.
Oh, it's great. It's great to be here. Thank you for having me.
Now, so many people are affected by low back pain. I hear about it all the time, and I'm not a chiropractor. What are the most common causes of low back pain that you treat in your clinic?
The most common causes are twisting, bending, and lifting. They typically cause either strains or sprains on the muscle and or compression of nerves that inflame the area. That's probably the most common thing that happens to your back. And then followed by degeneration, disc bulges, and disc herniations.
Do most people injure themselves at work or at home or doing something crazy like playing rugby?
No, that's kind of more of a romantic picture that people have in their head of injuring the lower back. But the reality is, it's not usually something, it's not the guy out playing football. Mm-hmm. It's usually more along the lines of either a labor job over long term or a sedentary lifestyle job, like sitting in front of a computer desk for many, many years, that aggravates the spine and causes degeneration over time. And then there's some little movement that's kind of like the straw that broke the camel's back. So it's been building up for a long time, and then the patient does something like where they twist a certain way, and they may have done it 100 times, but all of a sudden they feel severe pain. And it's not until we usually take an X-ray or an MRI that we can discover that this is a problem that's been building up for a long time, and that was kind of the straw that broke the camel's back.
Interesting. So it can sneak up on us. What exactly is happening, like mechanically, when you have that kind of an injury?
You take your left fist and make a fist, and then on your left hand, mm-hmm. and make a right fist, and put your right fist, place it on top of your left fist. Those essentially would represent two vertebrae in the spine, each fist. And if you shift or shear the right fist on the left fist, kind of forward, that would represent a misalignment of the vertebrae. We call that subluxation. When that happens, it can compress a nerve. It can inflame an area. It can rupture or herniate a disc. There's various things that can happen from misalignment. And so that's typically the mechanism of injury in the spine, in the lower back, where you get lower back pain.
It's really...
Most commonly, it's going to pinch a nerve.
Yeah, it's really interesting to kind of get that visual picture that you're painting for us with the fists. I'd never really thought of it that way until you explained it. Dr. Linninger, I know we're talking about low back pain today, but what other conditions do chiropractors typically treat?
Well, a myriad of symptoms can be helped by chiropractic, because when you take pressure off the nerves in the body when they're compressed, and you remove that compression of nerves, the brain now can communicate with that part of the body normally again, and cause 100% functioning to an area that might not be functioning so well. So patients always come in, the most common symptoms that they come in telling me about are lower back pain, neck pain, headaches, carpal tunnel, sciatica, leg pain, numbness and tingling in the arms and legs. Those types of things are what typically someone presents with, and that we typically can help them with. Having said that, there are a myriad of other symptoms that the patient may have in addition to those initial, what we call neuromuscular physical symptoms or neuromusculoskeletal symptoms that are occurring because those nerves also innervate organs in the body. So, for instance, when a patient comes in with middle back pain between the shoulders, that might be the first thing to tell me. But then when I take them back to the exam, I might ask them, to show me the area where they're having pain, and they point right to the middle of the spine at, say, T4, T5 level. That's the fourth and fifth thoracic level.
Mm-hmm.
And I know that nerve not only goes to the muscles in there, but it goes to the lungs. So I may ask them, have you also had any problems with shortness of breath, frequent coughs, history of asthma, bronchitis, those types of things? And sure enough, yes. I've had all that. I've had asthma since I was a child.
Oh, wow.
I hear that all the time. So those are some visceral somatic symptoms attached to the same nerve that are controlling the muscles in that area, inflaming them. They're also inflaming the lung lining. So many times when we treat that patient and remove that interference in that nerve, not only do they tell me that their back pain is gone, but they also tell me they're breathing better, and they haven't had an asthma attack, their shortness of breath is gone, they're not having frequent bronchitis. And that's just one example of a different visceral symptom that it clears up at a patient that I treat. So, that might not be on the front of their mind when they come in, but it definitely clears up in many patients when we reduce the inflammation in the nerve that's affecting those areas.
That's I want to say brilliant. But
does that make sense to you?
It makes a lot of sense, and it's something I would never have expected you to tell me just now.
Here's another one. 9 times out of 10, when a man comes in to my office with lower back pain, 9 times out of 10, when I get them in the exam room, I'll ask them if they're having difficulty in the bedroom. And they'll tell me, you know what? Yeah, absolutely, Doc. How did you know that? And I'll say, because when they touch their back and they point to the L45S1 nerve, I'll ask them a couple more questions, because I know that nerve is the pelvic nerve as well as going to the lower back. It goes to the genital area.
Oh,
so
my goodness.
Many, many men that are having inflammation in the lower back also cannot maintain an erection. So is that the only thing that can cause that? No. But
right.
If we treat them and reduce the inflammation in that nerve, that same patient at a re-exam will tell me not only has his back pain cleared up, but his marriage is better.
Oh, you're a miracle.
And it's not because I did something to him or I cured him.
Right.
Because I helped him remove the inflammation on that nerve, and his body just normalized.
Right. Oh, that makes so much sense.
Does that make sense?
Yes. Now, kind of changing directions a little bit, when someone has gone and had treatment somewhere else, maybe an unsuccessful surgery on the low back, can you then come in and treat that patient on the back end of that surgery if they've already had medical intervention?
Absolutely. It just depends on the timing. I've treated patients that have had an unsuccessful surgery within just a few months of the surgery. We're not going to physically, mechanically adjust that area. If there's hardware in there, you won't be able to move it anyway, even if we try. But we're not going to try to re-injure that area. What we're going to do is use things like laser treatments on them in that area, where we may adjust above where they did the surgery or below it. We may do some decompression work above and below the surgery with a spinal decompression table. We can do vibration therapy with them. We can do physical therapy with them. There's a lot of things other than adjustments that we can do to that area. They respond. The new surgeries that I've treated after the surgery respond really, really well to deep tissue laser treatments in our office, and that's very, very safe.
Oh, okay. So there's not a lot of manipulation. Yeah.
No, you're not going to manipulate that area or adjust that area, but you can do some other therapies to that area to calm down the pain. Now, if the surgery was many, many years ago, then it's a non-issue altogether in most cases. But you have to see the X-ray or the MRI before you proceed into what you're going to do as a doctor to make sure it's safe for the patient.
Is there any other things that people should expect under a chiropractic care that would differ from the type of care they would receive from a traditional medical facility?
Well, are you talking about primary care?
Yeah.
A family physician?
Sure.
Or a specialist?
Well, that's a good question. And maybe that's a question I don't know how to differentiate.
Okay,
but how is chiropractic different?
If you're dealing with, blood pressure and problems with infection, viral problems, bacterial infection, colds and flus, general things like that, blood work, that's all in the wheelhouse of most family primary care physicians. I mean, that's what they deal with all day long. So when you're talking about neuromusculoskeletal problems, that although they may see some of that, the general practitioner, typically that's not what they specialize all day in. Their specialty tends to be along the lines of how many white blood cells are there, how many eosinophils are there, reading the CBC, checking the blood pressure, that stuff. If you have an issue with that, we refer to the family physician for that. In my office, I consistently, say, look, I want you to go back to your doctor, and I know many of them in the area, and I want you to, have him do some blood work on you. I want you to have this checked out because I think there might be an issue here. And so if it's those types of issues, then your family practitioner is very, very, very good at diagnosing and treating those types of issues. Neuromusculoskeletal, family physicians, they may treat with non-steroid anti-inflammatory drugs or pain medications, or they may refer out to a chiropractor or physical therapy, but they don't typically treat other than providing pain medications and maybe giving you some instructions on bed rest. They don't really specialize or deal with those conditions as many times during the day as, say, I do. Does that make sense?
Yeah, absolutely.
Okay, so
absolutely.
They're typically just going to give you some pills, and on your way, if you don't get better, you're going to come back, and they're going to give you either more pills or they're going to refer you out.
Right.
Now, an orthopedist, is really, really good in when you're dealing with a fracture or a broken bone or something, but they're not very good with dealing with chronic pain control unless the only thing they typically do with that is they can do a stimulator, injections, or a surgery. And sometimes those work and sometimes they don't. But those are more invasive procedures than what we do in my office. So, I would rather see the patient start out with more conservative measures, like what we do in here first. And then, if they're not getting better, and it does happen occasionally where a patient's not getting better in here, we will co-treat them with the orthopedist, who will do usually the ones I like to send to start out with trigger point injections first, before they go down the road for surgery. The ones that we refer back and forth, they tend to do those procedures on a last resort basis. But that's not true for all specialists.
Right.
Some specialists, you walk in and they'll do surgery right away.
Wow. Well, we've covered so much ground today.
I know. It's been a lot.
So I'm going to give out your phone number and website address in case somebody wants to contact you to book an appointment and learn more about chiropractic. The phone number is 703-396-7770. And the website is www.chiropractor-manassas.com. And if you can tell us where you're located so folks can find you.
Right next to Klein's Freeze Ice Cream on 28.
Yay. We are out of time, but if you can think of someone who might benefit from what we've covered here today, they will thank you for forwarding this episode on to them. And a reminder, if you enjoyed the show, you can also share us with your friends on Facebook at facebook.com/Manassas Web Radio. Dr. Leninger, thanks so much for the education today.
Thank you for having me.
Thank you for listening. To join a discussion, visit us on Facebook at facebook.com/Manassas Chiro. And to schedule an appointment with Dr. Steve Leninger, call 703-891-9501. That's 703-891-9501.